Hi, and thank you for dropping by. I'm Cheryl Fox of Fox & Associates Wellness Case Manager. I'm the owner and the founder. I founded Fox & Associates over 8 years ago while I was doing home care and discovered that there is a great gap in need in our families and in our community for the elders and elder care. Our health care certainly didn't meet the goals that it's intended to, and people oftentimes fell through the cracks. So I started with me, and 3 months later, a second nurse, and now I have an agency with over 50 staff members providing not only nursing care oversight, but we also provide caregiving services. We start pretty basically with our administrative staff in the office. Each person is personally trained by me and provides services and care and compassion to everybody who calls. We schedule our caregivers directly from this office and provide caregiving oversight. We do unannounced supervisory visits to assure that patients and clients are being cared for in such a way that is most appropriate and provides the highest quality of their life. All of our caregivers are hired independently by me. They are my employees. I carry liability insurance, workers' compensation, and they are also entitled to health care and to pension plan. We make sure that our family dynamics within the office are maintained with the highest level of integrity possible. We have good boundaries, we provide quality of care, we provide quality services. We have shifts as short as 1 hour and as long as 24. We provide care both in homes, residential care facilities, and skilled nursing facilities. We also have nursing staff. Very proud of my nursing staff. Many of them have been my students from when I taught at Santa Rosa Junior College. Others have been lifelong friends and colleagues. When we go into a home, we do our best to assess the situation in a very natural and normal way. We try to engage our clients and their decision makers by not being forceful, by being very genuine and very caring and very social. We are guests in their homes, and we always try to keep that as a primary thought in our mind so that we're not being intrusive and we're not being intimidating. Oftentimes our assessments include a nice lunch out to see how people react in the community. Sometimes it means we bring lunch in. Sometimes it means we're just there to visit. And we interview the person and engage them in conversation so that we can better understand what their needs are and where they are today, where they want to be tomorrow, and how we can help them accomplish that goal. We work closely with physicians, attorneys, private fiduciaries within our community, again to maintain a high level of safety and security within our community for our elders. Once we are hired, it needs to be known that we are hired as the advocate for our client. Sometimes this doesn't work well for families, but the truth of the matter is everyone needs somebody to support them. And at times when changes are being made in one's life, such as having other people making decisions for you, it's a time when you really do need somebody that is there on your side all the time, pointing out that what is about to happen and what has happened for you is in your own best interest. Some of what we evaluate is what the nutritional status is. What are the nutritional needs? How can we put that into place, and how is that best met? Who are the best people to meet that need? We also look at functional limitations and have the home evaluated in such a way to determine safety and if assistive devices need to be put into place to keep our person safe and well in their home. We look at what the functional limitation might be. It may be that they are bedbound, may be that they are heading towards hospice. What are the things that are going to need to be added to their daily routine, and how are they going to be able to have that added in such a way that makes sense and is not forceful and intimidating to them? We work closely with all hospices in Sonoma County. We have a very high degree of credibility with them. They enjoy our work very much, and they know that when we're there, that their patients are being well cared for in a way that that dovetails with the philosophy of the hospice programs. We also work closely with home care agencies, and we try to provide what is called palliative care in the home for those who don't feel that hospice is appropriate, but they don't want to be bouncing back and forth into the hospital all of the time. We work diligently to provide in such a way that everything makes sense, common sense, which is a very rare commodity in our healthcare system. We instruct people on basic needs and universal precautions. We eliminate infections as much as possible by teaching infection control, not only to the patient or the client and to their family, but to anyone who's going to be in the home, including our private caregivers and our nursing staff. With home care agencies, if we identify a need, we contact the doctor and ask him or her to please make a referral, being specific about what we see the need being. If physical therapy, occupational therapy is needed, home care is called in. If a nurse is needed to do wound care, we make sure that home care is available for them. We always look towards the goal of potential discharge from both Fox and Associates and home care needs. And that sometimes is achievable. At times it is not achievable. Therefore, we're there until the last. We make sure that the home is suitable for required care and function. We make sure the physical layout, sanitary conditions are maintained, adequate telephone service is available, adequate outlets. We watch closely for hazardous areas of hazard that may be hazardous, such as obstacles of mobility, safety devices in the bathroom, objects within patient's reach, instruction in fire safety, patient family instructed in safekeeping of valuables, and instructed in the use of DME, or durable medical equipment. But one of the most important things that we do is we advise family. We advise family and we guide them to the most appropriate levels of care as well as the most appropriate levels of professionals. Oftentimes we refer to elder care attorneys when it comes time to have those papers that need to be completed in such a way that they are most appropriate and that they are meet the letter of the law. We also work with private fiduciaries, which is a wonderful, wonderful service in our community. A fiduciary is just that, is someone who has been licensed by the state of California to assure that the fiduciary needs of each individual is met. They can both provide as successor trustee for durable powers of attorney for healthcare and finance. They can also act as trustee. They can act as conservator of person and or estate. This puts the situation out of the family dynamic that sometimes can be very, very, very difficult to deal with, because when we are the family, oftentimes what can happen is that our family dynamics carry forward to a critical time when our loved one no longer has the ability to make decisions for themselves. This is oftentimes a point when the mortar in the family starts to crack, if not break, and fall apart completely. With a fiduciary, they can take all of the tasks at hand in regards to the person's personal cares and needs, as well as the financial, and put it completely into a business scenario so that family can still have input and make sure that their loved one is well cared for, but not necessarily have to be the bad cop where the hard decisions are being made. This is just a sample of some of the work that we can do together. I certainly would be more than happy to talk with you or have one of my associates talk with you to help you figure out the best ways and the best routes for you and your loved ones to go. please don't hesitate to get in touch with us. You can email me at cheryl@foxandassociates.com, or you can call us at area code 707-573-0223 and ask to speak with Cheryl Fox or one of Cheryl Fox's associates. Thank you so much for watching.